Hi guys, so I'm sorry for my ridiculously long hiatus. I was disappeared for almost 3-4 weeks now. The reason was I was working nights to finish up my ObGYN, so I figured I might as well make a video about my ObGYN rotation. And the other reason was I just took my step to CS, so I'm gonna include some tips and tricks to pass your CS as well. But for the first part, the ObGYN rotation. So my ObGYN rotation was 6 weeks long. It was split up into three 2-week intervals. So the first part was clinic, which I really enjoyed. It was really fun. And the second part was GYN, and the last part was labor and delivery. In clinics, the first 2 days I worked with midwives. We were just doing basic OBGYN exams, just nothing special, just doing speculum exams and things of the sort. I had a fear of pregnant women and babies. I know I did pediatrics, but I still had the fear of it. So this rotation really helped me get over the fear of pregnant women and babies. The midwife I worked with was really nice and really actually pushed me in the right direction, so that I could, get over my fear. She was very patient, and I also want to thank all the patients who put up with me. They said I was good, but inside, you have that feeling when other people tell you you're doing okay, but on the inside you feel like, oh my god, what am I doing? It was kind of sort of like that. But by the end of my first few days after working with the midwife, I had pretty much my skills down. I knew how to do the Leopold, speculum exams, just the basic GYN exams and the sort. That was down. And then the second part of the clinics was working in the specialty clinics. So that was high-risk clinic, where you had women with advanced maternal age. You had women with previous placenta previa, placenta creta, high risk for drug use, which was quite common in that area. I was in the Bronx. Unfortunately, it happens. I also went to the reproductive endocrinology infertility clinic. So that was where we had patients who were trying to get pregnant over an extended period of time, which would be more than a year for the population I saw, because they were quite young, and less than 6 months for people over 35. That was interesting. It was a lot of detailed histories and paperwork at first, and then you got into the medicine of it. But you had to have a lot of blood work and history done before you could start. I also did urodynamic studies. That was my favorite. It was most gratifying because you had all these women who had urinary incontinence, who had uterine placentia, and a small pessary or a small pill could fix their problems, and I felt like that was very gratifying. Yeah, I really liked that part of it. And then I also had there was another part where they counseled young women about reproductive health. Yeah, so that was reproductive health, forms of contraception, and things of the sort. So yeah, this was, the different the clinics I worked with. GYN service, which was this the second third of the rotation, was a lot of surgeries and scrubbing in, following up post-op patients, pre-op patients. So it was like a mini surgery rotation. And the last part was labor and delivery. That was where I had disappeared to, because we had to work nights, and we worked from 4 in the evening to, well, I was supposed to be there till 8, but I left around 6:37. And we did that 5 days a week, for 2 weeks. And let me say that I have a lot of respect for people who do this for a living and residents who have to do 5 weeks of this. That is crazy. But having said all that, I learned a lot during labor and delivery. Just learning the difference between normal physiologic cramping and abdominal pain to actual signs of labor. Because if you haven't seen it before, it looks very similar. um, delivering babies was an eye-opener. You know, having read something in a textbook and actually seeing it, it's mind-boggling. It's like, whoa, what just happened? The baby just came out and it's in my hand? Like, whoa. I know I sound very immature right now, but it's like, holy, there's a baby in my hand. That was interesting, just to see the baby take its first few breaths in front of you. That was very grounding. It makes you feel very small and insignificant, like you're the part of this big giant world and things where births and this miracle of life happens. I thought that was pretty fascinating. I don't know, I was just shocked. And then you also, get these patients who are not been lingering, but they're just tired of the pregnancy and they can't take it anymore at home, and they're about to deliver, but there's no one to take care of them at home, so they just keep coming to the labor and delivery triage, hoping that this time we will induce them. But you see a good mixture. You get to do a lot of cute ultrasounds with moms and their family, to show them the head and face. Maybe it's just me, but I had a hard time. Well, not a hard, but it was not easy for me to learn how to do an ultrasound. First of all, it's a moving target, and you're like, baby, slow down. You're moving so much, I can't even find you. But eventually, I think after the first 4 nights, I got a hang of it, and finally I was like, oh, let's do baby measurements, and then we figured it out. But yeah, by then, it was okay with, checking cervical dilation, the ultrasound, checking for effacement and dilation, the stations, so that was good. And then we got to deliver some babies. That was fun. Besides the night, I would think that overall the ObGYN was an excellent rotation. I really enjoyed it. It's work. It's definitely a lot of work, and what I would suggest is that before anyone starts working labor and delivery, you study for the actual shelf exam, because that's what I tried to do, and I did okay. I did above the national average, but I wanted to do better. Study tips that I used was I used the Step Up Secrets, Step Up to Step 2 Secrets. It has the ObGYN and gynecology section. I felt like that was really helpful to just kind of skim through when I was working, if I didn't have a lot of time to actually read, a lot of text. I also used Kaplan questions, so I felt like those were really helpful. I think I had like 10 more U-World questions left. I couldn't finish them all because I didn't have enough time, but I felt like that was extremely helpful. I tried using blueprints, but I ran out of time, so I couldn't really finish that. But I did do Master the Boards, ObGYN section, and I tried doing case files. I've heard everyone say case files really good, but I didn't have time to do it. But yeah, for me, I think questions work the best, so I tried to do as many questions as possible. Overall, yeah, I really enjoyed this rotation, and thank you for watching this. I'm going to make another video, because this is getting too long, about Step 2 CS and my tips and tricks for it. Thanks.